Hello friends, welcome to this channel Easy Medical. Watch the video till the end, and if you like it then press the like button and click on the subscribe button and press the bell icon near to it to get the new updates, and share your reviews in the comment section. So let's get started. Today's topic is necrosis. We will mainly go through its definition and its type, that is gross and microscopically. So necrosis means cell death. Apoptosis is the planned cell death. That is, it is also called suicide, but necrosis is cell death, which is caused by some agents, just like hypoxia, immunological injury, microbial agents, chemical and physical agents. So what occurs in the necrosis? It is a localized area of the cell death. As you know, the tissue gets degraded by the hydrolytic enzyme liberated from the dead cells, and then the inflammatory reaction takes place at that place. So this is all about necrosis. Let's study it. Let's move on to its types. So it consists of the 5 types, that is coagulative necrosis, also known as ischemic; liquefaction, also known as the colliquative necrosis; caseous necrosis, it's also know it is the sum of both coagulative plus liquefaction necrosis; fat necrosis; and fibrinoid necrosis. Let's study them in detail. Coagulative necrosis, also known as the ischemic necrosis, it is the most common necrosis, and it is mainly caused by the irreversible focal injury which occurs due to the sudden cessation, that is stoppage of blood flow. Therefore it is also known as the ischemic necrosis. The organs main affected are heart, kidney and spleen, just they are also affected due to the ischemia, so as it is. So now move on to its graph. So in early stage, the focus of this necrosis is pale, firm, slightly swollen, called infarct. With progression, as the time passes, it becomes yellowish, softer and shrunken. Then let's go to its microscopically how the changes occur. That is, the hallmark of this necrosis is conversion of normal cell into that tombstone. What does it mean? It means that the outline of the cells are retained, but the cytoplasmic and the nuclear details are lost. You can still identify the cell, but the main contents are lost. The necrotized cells are swollen, have increase in their greater eosinophilic cytoplasm, infiltrated by inflammatory cells. This shall also show the nuclear changes of kind pinosis and karyohexis or karyolysis. We will study them in detail later on. So liquefaction necrosis, that is also known as the colliquative necrosis. What do you mean by colliquative? The conversion of the solid form into the semi-fluid form is called the colliquative. So that's the mechanism of this necrosis. It occurs due to the ischemic injury, bacterial and fungal infections. The hydrolytic enzyme in this tissue make it semi-fluid material, as we talked about it. Example, brain and abscess cavity. Now, so grossly the affected area is soft, and the cyst wall is formed around it, and the liquefied center contain necrotic debris, and microscopically the cystic space contain necrotic cell debris, macrophages filled with the phagocyzed material, and the cyst wall is formed by the proliferating capillaries, inflammatory cells, gliosis, that is a glial cell in brain, and fibroblast, that is proliferative in abscess cavity. So this is all about liquefaction necrosis. Now next is the caseous necrosis. Caseous necrosis, it is a cheese-like. Mainly it occurs in the tuberculous infections. This necrosis occurs in the tuberculous infection. It consists of the combined feature of the coagulative and liquefaction necrosis. Now, grossly, that is, its focus resembles like dry cheese, as we talked earlier. It is soft, granular, yellowish, and this occurs due to the effect of the polysaccharide present in capsule of the Mycobacterium tuberculosis. Microscopically, the center of the focus contains structureless eosinophilic materials, scattered granular debris of disintegrated nuclei. The surrounding tissue shows granulomatous inflammatory reaction of the epithelioid cell, giant cell of Langerhans, and peripheral mantle of lymphocyte. So this is all about caseous necrosis. This all you have to just mug up because there is no way to understand it. So now let's move on to the fat necrosis. So fat necrosis, it occurs in the fat-rich location in the body. For example, traumatic breast necrosis, especially in the heavy and the pendular breast. Mesenteric fat necrosis due to acute pancreatitis. These both are the main site. And here the mechanism is there is a hydrolysis and the rupture of the adipocytes, that is fat cell, causing release of neutral fat which changes into glycerol and free fatty acid. So this occurs, and grossly it appears yellowish white and firm deposits. Formation of the calcium shock gives chalky white appearance to it. And microscopically, cells have cloudy appearance surrounded by the inflammatory cells, and calcium shocks are identified as amorphous granular basophilic material. So this is all about the fat necrosis. Now let's move on to the last one, that is fibroid necrosis. So fibroid necrosis, the deposition of the fibrin-like material. Properties of fibrin such as PTAs, that is phosphotungstenic acid hematoxylin stain. It occurs in the immunological injury, arteriolus in hypertension and peptic ulcer. Now microscopically, it is brightly eosinophilic, hyaline-like deposition in vessel wall. Necrotic focus is surrounded by the nuclear debris of the neutrophils. Local hemorrhage may occur due to the rupture of the artery, etc. So this is all about the necrosis. So hope you enjoy this video. So click on the like button and subscribe and share it. Thank you so much.